So today we are going to study about pathology and laboratory code. And this code starts with 80,000 series. So 80,047 to 89398. So we can say 80,000 code series means it is a pathology and the laboratory code. And first we can see this organ or disease oriented panel. What is this organ or disease oriented panel? These panels were developed for coding purpose only and should not be interpreted as clinical parameter. The test listed with each panel identify the defined components of that panel. So this panel means it consists of a group of laboratory tests based upon or they are classified or arranged for coding purpose only. And we cannot consider them as a clinical parameters. Okay, only for coding purpose, we have made this organ or disease-oriented panel. These panel components are not intended to limit the performance of other tests. If one performs test in addition to those specifically indicated for a particular panel, those tests should be reported separately in addition to the panel code. Do not report two or more panel code that include any of the same constituent test performed from the same patient collection. So all these we can just go through the panel codes and through example we can study more. So these are the different organ or disease oriented panel from 80,047 to 80,081. Laboratory panel are grouping of lab tests that a physician might order that are all covered by one code. So this one code or one panel has many lab or group of lab tests. Do not report two or more panel code that include any of the same constituent tests performed from the same patient collection. Again, through example, I will explain more. So just we can see this panel code. So basic metabolic panel, otherwise called the calcium ionized. Basic metabolic panel, here it is calcium total. General health panel, electrolyte panel, comprehensive metabolic panel, OB panel including HIV test, lipid panel, renal function panel, acute pancreatitis panel, and hepatic function panel. Now, we can see separately. So here we can see 80,047 is a basic metabolic panel calcium ionized, whereas 80,048 is basic metabolic panel calcium total. What is the difference? If we go through, what is this panel? Basic metabolic panel means we can see 1, 2, 3, 4, 5, 6, 7, 8 tests. Calcium ionized, carbon dioxide, chloride, creatinine, glucose, potassium, sodium, urea, nitrogen 1. All these tests comes under basic metabolic panel, that is a calcium ionized. So we can see the first code is a calcium ionized. And what is the codes given in the bracket? So if the question is, or if the physician has done only or the patient has undergone only calcium ionized, then we have to record only 82,330. But if the patient has undergone calcium ionized basic metabolic panel, we should report only 80,047. We should not report these codes separately because all these codes are included under one panel. And what is the difference between 80,047 and 80,048 as the heading, calcium ionized and calcium total? So these also include 8 tests. This also include 80,047 as well as 80,048. Both of them include 8 tests. But 80,047 is calcium ionized, whereas the other is calcium total. Clear? Now next, general health panel. General health panel consists of comprehensive metabolic panel, that is a blood count, complete automated and automated differential WBC count, or blood count complete CBC, automated and appropriated manual differential WBC count, as well as TSH, thyroid stimulating hormone. And 80,051 is the electrolyte panel including carbon dioxide, chloride, potassium, and sodium. And this is the comprehensive metabolic panel, and this include all these codes. 80,048 is the basic metabolic panel. So basic metabolic panel we have studied before include all these codes. Now, OB panel. So I told the OB panel, we can see two difference. That is the OB panel 80,055 and 80,081. The difference is one is having HIV. This 80,055 is not having the HIV test, whereas the 80,081 OB panel include the HIV testing. Lipid panel. Lipid panel, we know we usually do the lipid panel with the cholesterol, serum total, lipoprotein, that is the HDL cholesterol, triglyceride. If the patient has done only HDL, we must only report 83,718, not the lipid panel. But if the patient has done total serum cholesterol, HDL cholesterol, triglyceride, then we have to report only 80,061. Not 82,465 or 83,718 and 84478. Then renal function panel 80,069. Now 80,074 is acute hepatitis panel. Hepatic function panel is 80,076. So let's see an example. Which of the following panels does not include chloride? So this is does not include chloride. So first code 80,061. This is a lipid panel. It includes cholesterol, serum total, lipoprotein, HDL, triglyceride. So we can't see the chloride here. Now next, 80,050. So general health panel, and this include comprehensive metabolic panel. So we have to check what is a comprehensive metabolic panel, and here we can see this is the chloride. Okay, so 80,053 include which one? Chloride, as well as 80,050. Why? Because 80,050 is general health panel. So both 80,050 as well as 80,053 include chloride. So we can remove it. We removed B and C. Now check D, 80,047. What is 80,047? That is a basic metabolic panel. Again, we can see chloride here. So D also we have to remove. So our answer is A. A is 80,061, where we can't see any chloride but only total serum cholesterol, HDL, and triglyceride. So our answer is A, 80,061. Now, another example. The physician performed the following test on her automated equipment: HDL, total serum cholesterol, triglyceride, and a quantitative glucose. The correct code for this procedure are. So we can just check the codes. First is 83718. What is 83718? So if we check the panel, lipid panel, we can see lipoprotein, HDL, the code is 83,718. So we can see HDL here, and for HDL the code is 83,718. Now next, 82465. 82465 is total serum cholesterol. That also the patient has done. Now next is 84478. This triglyceride. So we can see 82465, 83718 and 84478. So what we have studied, instead of using separate code, we can use a single code for the panel. That is a lipid panel. What is the code? 80061. So we are having 80061 for option C as well as D. So So we are removing A and B. And so first we are using the code 80061. Now we have one more test performed, that is a quantitative glucose. So there is 82947 as well as 82950. 82947 is glucose quantitative and 82950 is post-glucose dose. But in the question, we can clearly see this is a quantitative glucose, not a post-glucose dose. So our code is 82947. So our option is C, not D. Clear? Okay, so our answer is C. 80061 is for the lipid panel, including HDL, total serum cholesterol, and triglyceride. And a quantitative glucose, the code is 82947. Now, another example, a patient present with right upper quadrant pain, nausea, and other symptoms of liver disease, as well as complaints of decreased urination. Her physician orders an albumin, bilirubin, both total and direct, alkaline phosphatase, total protein, alanine aminotransferase, aspartate aminotransferase, and creatine. Okay, so for easy, we are taking the panel 80,076 hepatic function panel. So we are going to check whether all these codes are there. So first is albumin. Albumin is the next bilirubin, both total and direct. Okay, now next is alkaline phosphatase. That is also the next is total protein. That also we can see. Next transferase ALT, alanine aminotransferase. Yes, that is also there in the question. And aspartate aminotransferase AST, that is also the. So when we check, the only code not present here is creatinine. Okay, so all the albumin, bilirubin total, direct, alkaline phosphatase, protein total, ALT, AST is there in the question. So we can report the hepatic function panel 80,076. But creatinine is all not there. So for creatinine, we have to report the code for creatine test. What is the creatinine test? Code it is 82,565. So our answer is 80,076 and 82,565 because this creatinine is not found in this panel. Now, a physician orders a general health panel, all tests except a creatinine, including CPC with automated differential. So, in this question, even though we can see a general health panel though. So what is general health panel? This is the code in the general health panel. But the physician has ordered the general health panel, but not which one? Creatinine. General health panel means comprehensive metabolic panel. So comprehensive metabolic panel is 80,053 with no creatinine. So if creatinine is not there, then we should report each code separately. Why? Only if creatinine is included, we can say this is a panel. If creatinine is not included, we cannot say this is a comprehensive metabolic panel. So in the question, this is general health panel. So what is general health panel? Comprehensive metabolic panel. That is a blood count, completed CPC and WBC or CBC automated and appropriate manual differential WBC count plus TSH. So with the comprehensive metabolic panel, we should also report TSH separately as well as the blood count. First, we are reporting the comprehensive metabolic panel. Then blood count, that is a complete CBC, automated and automated differential WBC, or blood count complete CBC, automated and appropriate manual differential WBC count. Okay, so either of one we have to report plus TSH. So comprehensive metabolic panel is 80,053, but as creatinine is not there, we cannot report this comprehensive metabolic panel code 80,053, but we have to report all these code from 82040 to 84520. Okay, so this is the codes from 82040473110. All this code we can see except the creatinine code, that is the 82565. Then we are reporting which one? The blood count. So blood count, automated differential WBC count is WBC count, automated differential WBC count, then complete CBC. The code is 85025. Okay, we are not only reporting automated differential WBC count, not. Here, this is a blood count complete CBC. So, for the complete CBC and automated differential WBC count, our code is 85025, and for TSH, it is 84443. Okay. Now, one more example. The patient is a 28-year-old female for routine lab test, part of her yearly physical exam. So here, what is the done? What are the tests she has done? Metabolic panel. Sodium blood, potassium blood, chloride blood, carbon dioxide blood, urea, nitrogen blood, creatinine blood, glucose blood, calcium blood, CBC, WBC, platelet count. All these tests she has done. So, for calcium total, this is the calcium. So, here if we check the panel, 80,048 calcium total. So, this is the calcium total. Next, carbon dioxide. Yes, carbon dioxide is here. Next, chloride. Yes, chloride. Creatinine. Glucose. Next is potassium. Then sodium. Now urea, nitrogen. Okay. So all these tests include 80,048. That is a basic metabolic panel. So first we are coding the basic metabolic panel. Okay, that is 80,048. Now next test is CBC. CBC complete automated. So for that, what is the code? So this include the CBC automated. All this is CPC. CBC complete automated. So for that, we have to report 85,027. Z00 is related with the ICD-10 code. So the question asks the ICD-10 that we will study in ICD-10 chapter. So here, all this first up to this is the calcium blood total panel, and so we are taught basic metabolic panel calcium total we are reporting 80,048, and for CPC automated complete we are reporting 85,027.